So, people, do you know this tablet dimethyl fumarate? Dimethyl fumarate. The interesting thing is, this tablet is not, they didn't teach us in pharmacology, right, in any classification. But now my cousin's wife actually, she has been prescribed this because she has multiple sclerosis. Okay. So basically, this is a drug used to treat multiple sclerosis. So if you look at what multiple sclerosis is, so first let us look at that. So multiple sclerosis affects the central nervous system, nerves. So what happens to the nerves? The nerves will have myelination issues. So see here, the myelin sheet, what they're showing here in blue, it's damaged here, damaged myelin. So the covering on the nerves are getting damaged. So this is autoimmune condition, and hence what she had, my cousin's wife, is vision issues. That's the only thing she has, vision issues and some fatigue. And that too, vision in one eye was slightly different, was her expression. However, to look at her or her eyes, everything looks normal. Okay. So the drug, one of the drugs prescribed for her was dimethyl fumarate. And when we look at the classification, when we look at the classification in pharmacology or KD Tripathi textbook, this drug is not there. Okay, that's what I wanted to tell you. So guys, look at this dimethyl fumarate. It is used in the treatment of multiple sclerosis. It is some immune response. It will change. It will suppress immune response. Obviously, it is an autoimmune condition that we are trying to treat, so it should obviously reduce immune response, right? So when you look at the treatment for what are we talking about, guys? Multiple sclerosis. Very good. So just look at these acute episode. That is, if sudden at that moment they are suffering, right? So they are talking about steroids. So oral dexamethasone, or if you want to give IV methylprednisolone, etc. Or plasmapheresis also they are talking about. You will have to change the plasma of the blood, right? So to remove all those antibodies which are causing all the trouble. So for acute, they are talking about this. Now let's scroll down for relapse prevention. Prevention here, see they have written here, dimethyl fumarate, okay? So 240 milligrams. So 10 grams less than 250. 240 milligram orally twice a day if you want to remember that. But I would more focus on the names of the drugs, right? So what else have you heard? Have you heard this one? Glatiramer acetate, this one. Some interferons are there. All these are interferons. Some MABs are there, like ocrelizumab, important to know. Right, we know this one now, dimethyl fumarate, very famous for us now. Then cladribine is first in the list actually, cladribine. Then fingolimod. Wow, what names, right? I wonder if any of these were there in our classification in KD Tripathi. We'll come back to that. Then there's one more we missed here, siponimod. Wow. Okay. Then teriflunomide. Okay, these are all for prevention of relapse. Okay, so then whatever you saw till now were first line. Now they are talking about some despite use of first line, if you have some disease activity, then relapse prevention, how will you do? That is more like second line, you can say, for prevention. Alemtuzumab, same. This cladribine is repeated here. Dimethyl fumarate can also be used. So that is why I think dimethyl fumarate, see these names are repeating. Fingolimod also is repeating, right? There are some other names. Metoxantrone, and then some MABs. MABs means what? It may be monoclonal antibodies, okay? This ocrelizumab had come on top also. Here you can see ocrelizumab. Then siponimod. Oh, it's not MAB, it's mod. MOD it is. Modulate. We'll go and check how much of this was covered in pharmacology for us. But anyways, just look at this now. High disease activity, typical lesions on MRI if there are there. Then again, they're talking about MAB, MOD. MAB. Okay. Actually, they are saying this. Let me go back to the textbook. These MODs are actually modifying the receptors, they are saying. Okay. Then primary progressive disease, same MABs. And then you have for active secondary progressive disease, MOD, cladribine and ocrelizumab. Okay. Same drug names are repeating. So what were we here for? Yes, dimethyl fumarate. Okay, so in that we are learning where dimethyl fumarate comes here. Dimethyl fumarate, it is given as relapse prevention first line treatment for multiple sclerosis for preventing relapse. Okay, and other options here you have are glatiramer acetate, cladribine, right? Then remember some interferons. Then you have ocrelizumab, siponimod. Okay, these are names that are repeating for in this list, if you remember. And acute episode, they're giving dexamethasone oral or methylprednisolone IV, and you can even they may require plasmapheresis if it's very serious. Okay, so the remaining names here are very repetitive, so I'm not going through them. You just need to know the concept. You're going to give some what are you going to give? For acute episodes, steroids. Then you'll give some things to prevent relapse. So if you hear dimethyl fumarate, just remember multiple sclerosis. Okay.